Okay, Assalamu alaikum. So let's start with today's session. So in yesterday we have studied about the basic part of investigational drug. We have seen the definition of investigational drug and how as a pharmacist, how as a physician, you are dealing with the investigational drug. In today's session, we'll be specifically focused, especially on the role of hospital pharmacist and how hospital pharmacist he is dealing with the investigational drug. So remember that after pharmacologist, he proves a new compound to be effective and safe in animal tests. Now, if this study it is done, now this study it is on the animal. Now the study which is done on the animal, it is something called as the preclinical study. Okay, it is called as the preclinical study because this study it is done on the animal. So any study which is done before conducting study on the human being, so that study it is called as the preclinical study. And who is going to perform that study? Obviously, he is also the pharmacist, or maybe he is the doctor also. The specialty is required in the pharmacology. So he must be the pharmacologist. So once you're done with the preclinical study and you have verified that your drug it is effective and safe in the animal study, and after that you can go ahead with the clinical trials. So now clinical trial you are conducting study on the human being. So now you are starting with the clinical trials in two steps. So first step it is preliminary step and second step it is the extended step. So obviously when you are going to give drug first time to the patient, so that type of step where you prefer to give drug to the small number of population. Okay. So and you are evaluating the drug for the shorter period of time where you are going to confirm about the effect of the drug. So that is called as basically preliminary study. And once that is done, then you are going with the extended study. So main objective of preliminary study to ensure safety of the drug. Now, if you feel that the drug it is safe, it is not producing very severe untoward effect, adverse reaction in a case of the patient, then you can go for the extended study. So these are the steps of especially in case of the drug development. So that is the preclinical study, and then you are starting with the clinical, and in clinical you start with the preliminary study first, and then you are going ahead with the extended study. So in preliminary stage, the chief investigator, so the person who is the chief investigator of that particular protocol, so he carefully administered drug to the small number of specific patients. So now why he is going to administer it carefully? Because first time you are giving drug to the patient. So that is the reason he is going to carefully administer drug to the small number of population. Again, you are here not exposed to the larger number of population because first you need to ensure the safety of the patient. So now you have exposed only to the small number of the specific patient, and you are closely monitoring the result in that particular patient. Okay. So you are going to monitor the result in that patient very closely, and you are trying to find out what kind of adverse effect that drug may produce in the patient, isn't it? So that is the reason you are closely monitoring the result of your study. So once you give the drug, you are continuously keeping that patient under surveillance, and you are observing for any the effect which is especially related to ADR, untoward effects, any side effect. So this is nothing but the safety pharmacology study you are conducting in case of the patient. This is in case of the preliminary stage. Now, after gaining experience and the confidence in the preliminary stage, now if you are done with preliminary stage in small number of population and you found that there is no untoward reaction, there is no adverse effect. So now you have gained the experience. Now you gain the confidence, okay, that preliminary state does not show any adverse effect. Once that is done, then you can, as an investigator, you can perform an extended comprehensive evaluation of its efficacy. So in preliminary study, basically you are looking for the safety aspect. So you are looking just for safety aspect in case of the preliminary study, okay? And once you have confirmed that drug it is safe, then the efficacy and pharmacological activity you are evaluating in case of the extended study. So in the extended stage, the pharmacist help in the development of the protocol. Now you are done with the preliminary study. Based on that, you will come to know that some plus and minuses about the drug. Okay. Then based on the nature of the study, the kind of disease you are evaluating for, As a pharmacist, your role is to develop the protocol for conducting that study. Now, whenever you target the protocol or whenever you develop the protocol, most important thing that you have to keep into mind that you are following the ethical guidelines. You are following the international ICH guidelines, isn't it? And you see that how after exposure you will get maximum data, which will help you to predict rightly about the efficacy, pharmacokinetics, pharmacodynamics aspects of the drug. Okay, so looking at that, as a pharmacist, you are going to develop the protocol. So protocol, it is basically a systematic procedures. It is more or less similar to the standard operating procedure. So generally standard operating procedure are the individual thing. For example, standard operating procedure for operating particular instrument. But for complete study, there is comprehensive document it is there, that is called as protocol. So right from start to the end, how to monitor, how to supervise, how to interpret, how to collect the data, what is the format for the your informed consent, what is the format for the case study data sheet. So all these things you are developing in the form of the booklet. Okay, so that is called as the protocol. And this study of the extended stage, it is generally done as a double blind test study. In investigation, generally there is two people who involved in the research. One, it is the patient, which are very important in terms of data collection, and second one, it is the physician. Now, if patient know that he is taking the test drug, and physician also know that he is taking the test drug, then there could be possibility of the psychological bias with the intention that yes, this is the test drug, it means it is going to produce certain effect, isn't it? So although if it is not producing the effect, but there are certain behavioral study which are very relative in nature where you may feel that drug should giving the effect. So to avoid that, was basically done. So in double bind, the patient को भी पता नहीं होता है कि कौन सा whether he is taking test drug or the placebo, and doctor is also not aware whatever drug he is giving, it is a test drug or the placebo. So both are blind, both are not aware. So now this psychological bias can be avoided. As a pharmacist, you are going to develop the protocol. You are going to develop double-blind test study. Now, when you are going to develop a double-blind test study, you need to first have to formulate the medicine. So the look of medicine or the tablet, it should be such that both tablets of the test drug and both of the placebo, they should more or less look similar. दोनों भी सेम दिखने चाहिए, इवन सेम कलर इज रिक्वायर्ड. Okay, so that neither patient nor physician can able to recognize that first drug it is the test drug and second drug it is the maybe the placebo drug. Okay, so that is the intention of the double blind test study. So both the patients and a doctor have no idea about distribution of the placebo or the potent article. So both they feel that it may be the drug it is given or it may be the placebo it is given. So in various area, the pharmacist help the physician, the patient, or his or her clinical research team in investigational drug studies. So this is also the one of the role of the pharmacist. So when I say various area, like you may say in case of documentation, you may say in case of the collection of the data, might be sometime the physician want you to customize the doses, so that might also be there. So there are various areas where pharmacist can help the physician, he may help the patient or his or her clinical research team in investigation of the drug studies. So we will see few of them. So first, it is assisting in the development of the study design. So this is the very important part where pharmacists contribute a lot. Okay, so the pharmacists help in the development of the protocol and control of the double-blind study. So the pharmacist is doing that, especially by preparing the experimental drugs and the placebo in precisely the same dosage form. Like suppose if you are giving maybe the test drug in the capsule, or placebo you are giving the tablet, then someone can easily recognize that yes, this is the test drug and this is the placebo. So to avoid that, what you are doing as a pharmacy, you are selecting precisely the same dose, same color, same shape, same weight. Okay, so that there should not be any distinction between the test drug and the placebo. So the recognized product are delivered to the pharmacist. So once it is done, maybe sometime one pharmacist it is involved in the formulation of those drugs, So now that is done, then that is handed over to the another pharmacist who is involved in administration of those particular drugs. So now, as a pharmacist, you are aware that this one bottle of the drug is a test drug. Okay, so you can label that as the T, or you can give your code to that particular drug. And the second bottle that you have received, okay, that contain the placebo. So as a pharmacist, you know that the bottle A, it is the T, bottle B, it is the P. Now, if you give this code T and P, then anyone can recognize T for test, P for placebo. So what you are giving some unknown code. Maybe for T, you are giving something called 1, 2, 3, or maybe P, maybe you are giving 4, 5, 6. Okay. So any unknown code you can assign to that particular drug. And now you can say that to the patient that M123, that is medicine 123 and medicine 450, you are giving to the patient. Now, as a pharmacist, you are aware because the recognized product are delivered only to the pharmacist, not to the physician, not to the patient. So, as a pharmacist, you are aware of that. Now, you have given the coding. Okay. So, now what you can do, you can dispense it according to predetermined pattern, and also to maintain the record of true drug and placebo administration. Now, only you know that the true drug, it means M123. The placebo, it means the M450. So, any code you can decide. And that code should be keep on changing every time, so that it should not be like for every research you are using same code. The day will reach where physician will start recognizing that yes, M123 means test drug, M450 it means placebo drug, isn't it? So don't do that. So keep on changing the code so that no one can able to predict it and no one can able to identify it. Okay. So the recognized product are delivered to the pharmacist. Then you are responsible for dispensing it according to predetermined pattern. So you are going to determine the pattern and you are going to dispense that drug according to predetermined pattern, and you are going to maintain a record of the true drug and the placebo administration. So you are only aware about the secret of this code. Okay. After that, the patient and the physician have no idea about distribution of the placebo or potent drug, because as a pharmacist, you have put the code on that particular drug. Okay. Then now the physician will give drug to the patient. Now patient will take that drugs and he will having particular effect of that drug. So that data will be collected. So that is called as the trial result. Now the data of the trial results are collected, and now once data of the trial result are collected, after that what you can do as a pharmacist, you can crack the double blind code. So once data it is collected, then you can crack the double blind code, means you can disclose it, not to the patient, not to this physician, but those people who are working with that data. So there is a separate team that which are expert in the data analysis, which are expert in the interpretation. Okay, they are generally very senior in nature. So for them, you can crack the double blind code available with the pharmacist. Okay. Now, once you crack that code, means you have disclosed that code. Crack means you have disclosed that code to the data analyst or to the patient persons who are involved in analyzing this data. Now they can able to interpret the result of that particular tester, whether it having the effect or it does not having the effect. So this is the first role of the pharmacist. Second important role, it is acting as an impartial collaborator. Means you are the collaborator at every stage in the hospital as a hospital pharmacist. Okay, the pharmacist can work as an impartial collaborator by maintaining all the records and the codes in the double blind study. So all the records and documents of this study you are going to maintain, and you are going to act as an impartial collaborator. You are not disclosing this information to anyone. In addition to this, the investigator have the advantage of 24/7 availability of code information. Now, how this information is available? Now he can go to the pharmacy and from there he can collect the information related to the code. Okay, and the ability to crack the code for the patient without risking the study. So this is also possible due to the services which is provided by the pharmacist. In addition to this, the pharmacist can combine all the data regarding the study drug and maintain them in the pharmacy. Okay, so this is the additional role of pharmacist. So till now, in case of community pharmacy, in case of the hospital pharmacy chapter, you have seen the role of the pharmacist, which is related to dispensing of the medicine, the storage of the medicine, arrangement of the medicine, and the counseling. But in those hospitals where you are dealing with the investigational drug, because the clinical trial, it does not happen in all the hospital. Only few bigger hospital having good facility, good number of the beds, ICU facility, and some expert doctor, if they are a consultant in those particular hospital, then for those hospital you are conducting clinical trial. So there your role, it is additional, where you are also dealing with the investigational product. So in addition to keeping the record of your pharmacy, you are also going to keep the record related to study of the drugs, and you are going to maintain those record also in the pharmacy. So these are different role, diverse role of the hospital pharmacies in case of investigational drug. Then the pharmacy can serve as a primary area, especially for the collection, storage, distribution of important information regarding investigational drug. So yesterday's session, we have seen that there are certain information that is given by the chief investigator. So chief investigator, in the form of letter, he is going to give detailed information of the drug to the PTC, that is Pharmacy and Therapeutic Committee. In addition to this, an investigational drug data sheet. Now you have seen that the informed consent. Another important document, it is the investigational drug data sheet. So all these investigational drug data sheet providing information regarding the investigational drug to the medical, pharmacy, and the nursing staff should be prepared by the pharmacy, because drug data sheet, basically it is the format. So this drug data sheet should include following information. So just I am going to trace, and I am waiting for maybe 1 or 2 minutes. You just quickly read it, so you will get idea what are the different information related to the drug that has to be maintained in case of the drug data sheet. Okay. So first thing, it is the drug designation and the common synonyms, then dosage form and the strength, dosage schedule and administration route, indications, desired therapeutic effect of that particular drug, potential adverse effect, contraindication. Contraindication means in which case that drug should not be given, storage requirement, and instruction for the dosage preparation and the administration. So these are the different things which cover all the information related to the drug. Now, if you are having the information of the drug in this total 9 points, it is going to cover comprehensively mostly all the information related to the drug, because you don't know when this information it is needed, isn't it? So you need to keep all this information related to the drug in the drug data sheet. So few additional information are there, like instruction for disposition of unused dosage. So now trial it is done. Now there are some unused dosage are there. So how you are going to dispose it? So you have to also consider environmental things, and based on that, there is different procedure for different drugs and the formulation. And lastly, the name and telephone number of the chief and authorized co-investigator. So this is very important, because any unusual thing happening in the trial, conduct of the trial, it should be reported to the chief investigator, or at least it should be reported to the authorized co-investigator. So that is the reason why you are providing the name and telephone number of the chief and authorized co-investigator. In addition to this, the review of the drug data sheet should be done by the chief investigator. Now we have seen protocol pharmacist banayega, drug data sheet pharmacist banayega, but he must have someone to oversee that process. So the person who is authorized to review and approve the drug data sheet is the chief investigator. So although it is a pharmacist who is keeping all this data, okay, but it is the chief investigator who is going to review and approve the drug data sheet. Okay. Then the copy should be circulated to the suitable pharmacy staff and all the unit of patient care where drug will be used. Because suppose nurses are giving the drug, then nurse must also know about adverse effect of that drug, contraindication of the drug, because they are working at the grassroots level, they are dealing with the patient and also the administration of the drug. So these copies should be circulated to suitable pharmacy staff and all the unit of patient care, maybe the nursing unit, wherever research is going on. Okay. So all those units, you are going to circulate that particular drug data sheet. Just we'll start with our activity 2, that is the learning assessment about this particular session. My first question is, as a part of learning assessment, what do you mean by preliminary and extended trial? So I'm expecting answer, which is directly written in the chat box. Yes, let's see who give the first answer. Okay, so 19 page 81 replied that administration of drug to the small number of the patients. Okay, 19 page 88 replied extended study for evaluation of its efficacy and double blind test. But what is major difference? The major difference between preliminary and extended trial, it is preliminary study is done on a small number of the people. The main target of preliminary study is the safety study. वो आपको याद रखना है. Extended study, you are once you gain good experience and confidence about the drug and safety of the drug, then when you move on to the more robust, more detailed, and more extended study, isn't it? So you are exploring to get more data related drug. Okay, so that is done. My second question is who prepare and review the drug data sheet? Who prepare and review the drug data sheet? Anyone? Just start writing answer in your chat box. Okay, so someone is saying that is the chief investigator, but chief investigator is not preparing the drug data sheet, right? The chief investigator ka role alag hai. Okay, so pharmacist is going to prepare. Very good. So pharmacist is going to prepare a drug data sheet. I can see very good answer for 19 page 87, 19 page 84, 19 page 39. You are right. Now, who is going to review it? It is prepared by a pharmacist and reviewed by the chief investigator. Very good. So 19 page 95 given the answer. So it is prepared by the pharmacist and this data sheet it will be reviewed by the chief investigator. Okay, very good. Good answer. Last question is enlist any three component of the drug data sheet. We have seen 10 to 11 component of the drug data sheet. You have to enlist just three. 19 page 73 mention about the dosage form and strain, indication, drug designation, and common synonyms. Very good. Very good. Okay, 19 page 88 added few more, that is contraindication, adverse effect, storage requirement. Very nice. Strength of the drug. 19 page 81 mention about the indication. Very good. Dosage schedule and administration route mentioned by 19 page 36. Okay. Common synonyms. Very good. Mentioned by 19 page 95. Name and telephone number of chief investigator or authorized co-investigator. Okay. Mentioned by roll number 74. Very nice. So these are the different detail which are there as a part of drug data sheet. Okay, so that you have to maintain as a part of your process. Okay.